Clinical psychology training programs and research overwhelmingly focus on negative and pathological emotions, personality characteristics, traits, experiences, and habits or compulsions, and trauma. But positive emotions and coping mechanisms have tremendous clinical value. This is especially true of humor, which is a sophisticated psychological defense. Humor plays a vital role in our society, both on a large social scale and in more personal daily lives between individuals for a number of reasons. It is used to cope with distress. It is used to discuss topics that are difficult. It is used to provide a sense of relief to people who share beliefs that may not be accepted by others, both on the left and on the right, and in general for people who are disinterested in politics or identify as independents or centrists. It is a crucial tool in society. The backlash that comedians or public figures who use humor face, especially those who use aggressive or hostile humor, has always been prevalent, but it seems to be fairly extreme more recently. These are some public figures you may or may not recognize who have experienced repercussions for humor use in their comedy, public interviews, and journalism, just as examples. Humor is also relevant as it has been directly used to confront biased research practices. You may recognize this group as the grievance study researchers. They are forgive me if I pronounce the names wrong, but Peter Boghossian, James Lindsay, and Helen Pluckrose. They used humor to demonstrate the bias in prominent research journals broaching a difficult and necessary topic in the social science world. I highly recommend that you watch the synopsis of the ridiculous papers that they had approved by journals on YouTube. You will laugh hysterically. I want to remind you that all humor is subjective and that what these academics did could be viewed as self-enhancing humor, which is finding joy despite absurdity or adversity, but may be viewed as aggressive. We should consider the subjectivity of humor when thinking about research findings, because how you classify humor used within studies matters to how you interpret findings. So a coder, for example, qualitatively might code an interaction as aggressive when it might be coded by someone else as self-enhancing, just as an example. Okay. In short, humor both facilitates conversations and can diffuse aggressive impulses. Clinical psychology training programs and research overwhelmingly focus on negative and pathological emotions, personality characteristics, traits, experiences, and habits or compulsions, and trauma. But positive emotions and coping mechanisms have tremendous clinical value. This is especially true of humor, which is a sophisticated psychological defense. Evidence demonstrates that humor can mitigate conflict in close relationships, and it can help the larger society tolerate conversations on topics that might otherwise be too difficult. Humor that is uncomfortable or even controversial can effectively broach difficult topics, both create and reduce tension, may allow for the diffusion of aggressive impulses, and reduce social discord. Humor can be a means of bonding in close relationships, self-preservation in difficult relationships, and is especially useful for those who are traumatized, work difficult jobs, experience social political marginalization, or people from different social cultural backgrounds. It is my belief that therapists need to have an appreciation for humor, or at least a tolerance of it, despite whoever is delivering it and how it is being delivered. We deal with incredibly difficult scenarios and emotions within our patients and ourselves. Increasing our capacity to notice, tolerate, and understand humor can be useful in metabolizing issues in larger culture and appreciating how patients manage all kinds of difficulties. Okay, here's a quick disclaimer. Let me preface the workshop by stating that research on humor is vast. The body of literature by theorists is huge. There are philosophical origins to analyzing humor creation and appreciation that would take hours to review, and I only have 20 minutes. So I will do my best to give you useful information quickly, but it's impossible for me to cover everything that would be worth saying. One thing worth mentioning is the origin of the concept of humor as involved in healing. Hippocrates described the humors as four bodily fluids: phlegm, yellow bile, black bile, and blood. That he believed needed to be in balance for a person to be well, and that if imbalanced were considered to negatively impact the person and cause illness. There were four of them, which is interesting because the most modern academic research conception of humor, which was created by Martin et al., has four types as well: affiliative, aggressive, self-defeating, and self-enhancing. The idea of balance and that all humor styles serve a purpose, even the ones that researchers typically deem negative styles, is something I want to consider over the course of the presentation, especially as researchers often will throw out the baby with the bathwater when discussing outcomes related to the negative types, self-defeating and aggressive. Humor is multifaceted. Theorists and researchers have emphasized, studied, and documented the importance of humor comprehension, appreciation, expression, and creation. The reasons people use humor and the timing of when humor is used has also been considered. These concepts have been measured using a variety of scales over the years, but as a solution to prior incomplete conceptualizations of humor, Martin and colleagues refined an overall, overarching conceptualization of the humor categories that today are used in research to classify humor. They considered humor as falling along a continuum from benevolent to aggressive, and as it relates to the self and others. A visual representation of the 4 humor styles in the 2x2 matrix looks like this. Okay. Martin developed the Humor Styles Questionnaire, a 32-item self-report measure with 4 8-item subscales to delineate and measure the 4 humor styles. Affiliative humor is pro-social and characterized by interpersonal benevolence. Self-enhancing humor is directed towards the self and is characterized by finding humor in incongruent elements of life and seeks to find joy despite adversity. Aggressive humor uses sarcasm, teasing, ridicule, and disparagement to relieve tension and is often done at the expense of others. Self-defeating humor allows others to laugh at one's own expense and may even involve encouraging others to be disparaging in order to be accepted. Okay. Research demonstrates a myriad of benefits related to the use of humor and the appreciation of humor in a variety of contexts. The HSQ, Humor Styles Questionnaire, has been used in empirical studies to assess outcomes specifically related to the 4 humor styles. A meta-analysis found that overall, self-enhancing humor had a strong positive relationship to mental health generally. Affiliative humor had a smaller positive association with mental health and was most strongly related to self-esteem. Self-defeating humor had a negative association with mental health, and there were no significant findings regarding aggressive humor and mental health, which is interesting. This meta-analysis provides support for the benefits of humor as related to self-esteem, life satisfaction, optimism, and depression. In one study, increased self-reported humor use in response to stress, the ability to maintain humor in difficult scenarios, and an appreciation for humor more generally were associated with a more positive self-concept, better cognitive reappraisal in response to stress, less negative affect in response to adverse life events, and overall more positive affect in response to positive and negative life events. In a study that aimed to determine the effects of resilience on successful treatment for patients with chronic PTSD, it was unexpectedly found that a single item related to maintaining a sense of humor in response to adversity, but not the full resilience scale it came from, was associated with a significant reduction in PTSD symptomology following therapy. The findings were remarkably robust. Endorsement of the item regarding maintaining a sense of humor predicted successful treatment. I love this finding. Such that per unit increase in humor score, there was a 125% increase in chance of successful treatment and 117 to 162% increased chance of remission from chronic PTSD. The finding demonstrates how powerful humor is, especially as a mechanism by which an individual acquires and/or successfully employs resilience. In a more recent study, a sense of humor was significantly inversely related to stress levels for healthcare workers in Italy who were managing patient care during the COVID-19 pandemic. This was in contrast to healthcare workers who tended to use more avoidant coping strategies, for which there was a significant direct correlation with stress levels. Results from other studies overall demonstrate links between the appreciation and employment of humor and the tendency to use a variety of adaptive coping strategies as opposed to maladaptive ones.